Studies in the CPG suggest that prophylactic antibiotic use prior to a dental procedure for patients who underwent a hip and knee replacement may not have any benefit in reducing the risk of periprosthetic joint infection. Nevertheless, the work group recognizes that the risk of periprosthetic joint infection still exists and recognizes the devastating impact of periprosthetic joint infection. Therefore, there probably is still some scenarios where it may be useful. We don't have good studies, or we don't really have any evidence to suggest when this should be, but for me, I would look at patients who are higher risk for infection. This would be patients who had a prior periprosthetic joint infection, patients who have an active dental infection, a significant dental infection in their mouth, that may be a scenario. Patients who have a lot of hardware, revision megaprostheses where there's more surface area for bacteremia to seed onto an implant. Those may be scenarios where you would want to consider prophylactic antibiotic use. The quick answer is we don't know. There are really no good studies on this topic. However, the work group recognizes that transient bacteremia following dental procedures does occur. Therefore, expert consensus recommendations are given. The experts in this scenario are dentists, infectious disease doctors, orthopedic surgeons, and they outline and recommend timing of dental procedures both before and after knee and hip replacement surgery. To me, this is one of the best parts of the CPG is Table 3. In my practice, I'm often getting the question of, when can this patient have surgery? They're having this dental procedure. Do we have to delay for this dental procedure? And a lot of times, I don't know the answer. Table 3 gives these expert recommendations. It's anywhere from same day for just a simple dental exam without any probing, which will have zero risk of bacteremia, to 3 weeks for more invasive procedures like extractions, like dental implants, and for patients with active dental infections. So we can look at this table and make recommendations for our patients. Our staff can look at this and see when it would be safe for patients to undergo joint replacement surgery and when it is safe for them to have the corresponding dental procedures both before and after. This is a hard topic to study. The rate of periprosthetic joint infections, luckily, is very low, a lot of times less than 1%. And to find differences in rates of joint infection for patients who did and did not have antibiotics prior to a dental procedure can be difficult and may require thousands and tens of thousands of patients. After looking through all the relevant studies on this topic, the work group found 4 low-quality studies that tried to address this question. These studies had tens to hundreds of thousands of people in them, so there was a lot of patients in them. They were cohort-based studies that looked at differences in rates of periprosthetic joint infection for patients who did and did not get antibiotics prior to dental procedures. Based on these 4 studies, there was no difference in the rate of periprosthetic joint infection, of getting a joint infection after dental procedure for those who did and those who did not get antibiotics prior to their dental procedure. These studies aren't perfect, as we note, they're low quality. They're basically cohort studies. They're not presented in a randomized fashion as the treatments, and therefore there can be a lot of confounding factors for patients who did and did not receive antibiotics. Nevertheless, we conclude, because of these studies, that the routine use of systemic prophylactic antibiotics prior to a dental procedure in patients with a hip or knee replacement may not reduce the risk of a subsequent periprosthetic joint infection. Again, the studies so far are showing no benefit to it, and therefore we can't strongly recommend its use for routine patients.